Hi, welcome to Mental Health Matters. I'm Shannon Eliot. It's my pleasure today to chat with an expert on the relationship between poverty and mental illness. Donita Diamata is the project coordinator for Financial Self-Sufficiency at Mental Health America of Oregon. Donita began her career in mental health advocacy over 20 years ago as an employee for a drop-in program. A few years later, she collaborated on a new drop-in program with the philosophy that all would be welcome. Having personal experience with both poverty and mental health challenges, Donita continues to advocate for change within the system. Welcome, Donita. Thanks for coming down from Portland today.
Thank you.
What is your personal experience with poverty and mental health issues?
Well, I grew up in some level of poverty, but I don't think that I really felt the full brunt of poverty until I was in my early 20s. And really it was after I first engaged in the mental health system. So what happened was I, after a couple of hospitalizations and then going in and getting services, I started getting this message that although I was working at the time, that I should quit working and go on SSI. And so I kind of fought against that for a while, but when you start getting the message again and again from people who you believe are experts, then you start buying into it. And that's what I did. So I actually did not quit my job, but I lost a job while I was in the hospital. And so when I got out, I decided, okay, I'll go for what they're saying is a good thing for me to do. And what I found in living in that kind of poverty, first of all, I brought in less than my rent. And so I supplemented having to pay rent and utilities with my food stamps. And so every month I was making these hard decisions of which to do, keep a roof over my head, keep lights on, or eat. So the things that ended up on the bottom as far as what choices I was going to make and how I was going to spend that little bit of money I had were things that centered around making it to appointments, because I didn't have transportation costs. You know, I had no bus fare. And then, of course, social stuff. I couldn't go to movies. I couldn't go out to eat, things like that. So I lived in increasing isolation. And so what they were trying to prevent me from living with a life of stress. But poverty brings on way more stress than actual working ever does, I think.
And
so,
that social isolation you just mentioned to go
absolutely, absolutely. So that was brutal. And so that was really where I got a good firsthand account of what poverty can do to a person. And I ended up actually more miserable than when I worked the worst jobs I ever had. So I'm glad to have finally decided to go against the grain, not follow medical advice, and I started working. And I found I thrived. And that's what most people do. When they find something that they're passionate about, most people will thrive. Yeah.
How did you feel when the therapist first told you, just go on SSI, don't bother working?
Yeah, I was shocked, really. Again, because I was working at the time in a job that I was pretty good at. So I was really shocked to have somebody, so I thought, are they seeing something I'm not seeing? And it starts kind of messing with your head, I think. I was really believing that maybe I'm kind of, not thinking in reality. So you start questioning yourself, and maybe work was more stressful than I realized, or something like that. Yeah, and you start buying into it. It's really difficult not to, I think, if you're told that enough from people who you are seeing, who are supposed to be educated, and they're supposed to have some expertise in this. So, yeah.
What kinds of statistics exist that show the percentage of people who live below the poverty line who also have mental health issues?
The sad fact is there really aren't very good statistics. There are poor statistics on just how many people really have mental health challenges in this country. We tend to look at who's presenting at mental health clinics. So we lose a lot of people in that with just those statistics. And then when we start looking at statistics of just poverty in general, and there's almost 50 million people in this country who are living in poverty, we don't really have a clue of how many people really are struggling with mental health challenges, because many of them are not presenting at mental health clinics. They're not presenting in places. And so we're just down to who presents. It's kind of like how the unemployment rate, what we look at there. We look at who is collecting unemployment. We're not counting all the people who are not. So that's, I think that's changing, which is good. There's starting to be more and more studies that are coming out. And just a couple of years ago when I started looking at this, this topic, it was really hard to find information, but we're starting to come together. There's some conjecture about how many people are probably living in poverty who also have mental health challenges, but there really isn't anything hard fact data.
Do you think more studies and these new studies you're mentioning will lend a certain credibility to the mainstream about this issue that hasn't really existed in the past? It seems like such an obvious and important link, but it's not something that people really know about or talk about.
Yeah, it's true. And I think part of it too is I think people sometimes, we do look at it. I mean, certainly, when we think of somebody who's homeless, the first thing most people think of are somebody who is either struggling with an addiction or somebody who has a mental illness, like schizophrenia. That's the first stuff that people think of. And those are the images that are kind of ingrained. So we have, I think as a society, we put the two together. But we've come to an acceptance of it, which is not okay. And I think that's the stuff that we really need to start challenging is, what is the connection between poverty and mental health challenges?
Not be complacent. That's a really good point.
Yeah.
Really good point. So how does the lack of basic resources contribute to one's mental health?
Well, sadly, in this country, the way we dole out services tends to be on a per capita basis. So we put, if a city, let's say, or a community has 20,000 people in it, let's say, this is how many social workers you're going to get, how much you're going to get in mental health services. That's kind of how they dole it out. So what happens is the poorest communities are the ones who have the highest needs for these services. They tend to need more mental health services, more mental health, especially community-based services, and they're not getting it because it's doled out evenly, and how we tend to do things here is wherever you live, that's where you go for your services. So you don't get to go to the, up the hill, where the nicer services might be, and you might actually be able to walk right in or something. You get to go to services where the likelihood is you can present and you are struggling, and what you're given is an appointment slip for 6 weeks to 3 months later.
So if you're in crisis, hypothetically, they could say come back in 90 days.
Yes, or more. Yeah, not unusual. So it's really shocking that this is how we treat people. And I think people think that, on the outside there are these great services, but they're really difficult to get to. And even if we have services available for people, they're really poorly funded. They are, and they need some kind of revamping, I think, too, in what we offer. So minority communities, for instance, they tend to get the worst services that are the least effective for them, and they tend to have the services that are not really very well crafted. Sometimes they're, so you end up with a situation where people, like for instance African American people who live in poor communities, they're more likely to present in an ED situation, like in an emergency department or in custody of criminal justice system as their avenue toward mental health services. And that's not okay. That's how we treat people.
So whether or not one has a diagnosis, how does just not being able to meet basic needs contribute to one's mental health or lack thereof?
Yeah, and that's, I think that's the crux here. When if you look at Maslow's hierarchy of needs, when you are struggling with your income, with paying bills, with keeping a roof over your head, and you also are struggling with where food is going to come from next, you are kind of stuck tending to that first pillar, maybe the second one, and those top tiers, they don't get addressed because you're so busy with the other stuff. So your chances of existing in a state of constant anxiety goes up. Chances of struggling with things like depression goes way up. That's the reality for people. And what happens sometimes is when people do present for mental health services, they do get the diagnosis. Now you've got generalized anxiety disorder, for instance. But what they're forgetting is there's a reason why the person is anxious. They're living in stress, everyday stress. And so people get the diagnosis when it's really something that if you remove the stress, the anxiety goes away. So magic. So,
it's so obvious.
Yeah.
So you mentioned this country, or much of this country, delivers services in the way that you go where you live.
Mm-hmm.
Are there, and insurance is another whole other tricky thing, but are there good examples of community resources out there that folks can go to maybe if they're in a city, not necessarily, by exact zip code or block that they live on, but something more communal?
Yeah, definitely. Peer support services, support groups, things like that are embedded in a number of communities across the country. So you have those kinds of things. Drop-in centers are popular sometimes for people. And for some people, it's just they will get their treatment comes in the form of like what everyone else does. They go to work and they have relationships with people that mean something to them, and they build families, and that's the stuff that is the most supportive to them. And so their support comes really from natural supports around them rather than the traditional treatment model. And so there's a number of people who live that way. So yeah, there are a lot of options actually for people that are on the outside of the mainstream mental health services that we think of.
What has research shown regarding the connection between low economic status and mental illness?
So a few years ago, there was a study that when they went into it, Chris Hudson went into it trying to figure out whether mental illness caused poverty or whether poverty caused mental illness. And what they found after it was a 7-year exhaustive study. It's really amazing what they found, that people, there is absolutely a strong correlation between poverty and mental illness, but it's not what we expected to see. What they expected to see was mental illness causing that, but it's really the other way around. It's poverty, not necessarily it's the cause of mental illness, but it definitely contributes to mental health challenges. And what they found is you're more likely to experience mental health challenges, and certainly more likely to be labeled with some kind of mental illness if you have grown up poor. And the longer the lineage goes with that poverty, generational poverty, the harder it is to actually get out of that poverty situation. So there's a strong correlation. And I do want to point out, though, just from my own perspective of working within the system, within and out of the system 20 plus years and getting to know a lot of people over the years, I don't think that my story is unique of being told, hey, go the SSI route. And the problem here is the poverty rate, the federal poverty rate is $11,490 a year for an individual, and SSI puts you at just below 75% of that. So you are really living in extreme poverty when you go that route. And so this is what we're guiding people toward, and that continues to happen across the country. So I don't know that it's actually having mental health challenges that can potentially bring you to poverty. I think it's having some engagement with the system sometimes in a wrong way can lead you down that path. So I just wanted to throw that out there as a personal note. Yeah.
How would mental health services change in light of the Affordable Care Act?
Okay, so there are a couple of things happening. If you couple this with parity, so the mental health addictions now can no longer be something that's that they can charge more for, that they can you cannot be turned away from insurance. You can't be denied insurance because of a pre-existing condition like mental health challenges. That's a common thing that people have been experiencing across the country. So there's that, and of course it opens it up for people who've been edged out of insurance just by the way of cost, so people will now have some avenues. And there's one more great thing too, and it's got a mixed bag. So there are definitely pros and cons, but the idea is to have more integrated care. And so what we can start seeing, potentially, mental health services being more embedded with medical services and having more of that sharing. So the pros definitely are the continuity of care. The cons, of course, are if you have mental health challenges and you'd rather not have your primary care doctor and your dermatologist and everybody else who you go see for unrelated reasons know about those, you may not have that option. They're going to share.
So you mentioned this a little bit earlier, but I am going to ask you the question just straight up. Does poverty lead to mental illness, or does mental illness lead to poverty?
The studies say, is particularly that study that I cited, the Chris Hudson study, says poverty leads to mental illness and mental health challenges, yes. I still stand behind my reasoning and my rationale, just seeing, and knowing what I know, that it's not the mental health challenges itself necessarily that can potentially lead somebody down the road toward poverty, but it's just the kind of messages that we may get that send us that way. But the truth is, 70% of the people who have mental health challenges and have college degrees make less than $10 an hour. So I'm not clear on exactly what's happening here. But I think what happens sometimes too is those of us who do want to get back into work, and maybe we've been on disability for a while and living on SSI for a while and haven't done it. So there are people out there with college degrees who, when we go through some kind of employment services, let's say, what we're fast-tracked to do is go toward working those kind of entry-level jobs. And I've worked with people who, when I met them, they were working as janitors and they had master's degrees, and they were making minimum wage. So there's that issue as well at play. I think we're doing a lot of disservice to people when we're sending them down those roads and not letting them explore what they're passionate about, what they're good at, and also what they're educated to do. Yeah.
So you mentioned earlier your own experience, as well as just a very common experience for people who are in the system. The therapist telling them, oh, you really shouldn't work, you should just be on SSI, don't think about reentering the workforce. Thankfully, you were a little spunky and you said, no, I am going to enter the workforce, thank you very much, but there's a lot of people out there who would just accept it. In your experience, how common is it, friends, acquaintances, et cetera, how many of them actually did end up reentering the workforce and getting a job again?
Well, not a lot. I've gotten to know, in the 21 years that I've been doing this work, and I've gotten to know people over that time span, let's say, relationships that go 15, 20 years at this point. And many of the people that I was working with then who were living on SSI are still living on SSI, sadly. It's very difficult to break out of that cycle, and the longer it goes, the harder it is, I think, to break out of that. You start losing confidence in your abilities and yourself. You don't recognize your own strengths anymore, and you become very reliant on other people calling the shots and making these decisions. So, yeah.
What kinds of mental health care options are out there for folks on SSI, and what is the quality of these options like?
Yeah. I think it depends on from community to community. There are some communities that really have decided to let's invest. There are some whole cities who say we're going to really invest in these services, and so more money is put into those services, and they're protected. Even when cuts happen, there are very few that get hit with mental health services as far as the cuts. And then there are other communities where they're sorely underfunded, and when you look at what people are going to be reliant on who are really living in poverty, particularly people who have no insurance, because there are plenty of people out there who live in poverty too and do have insurance, and so they're going to go the private sector route. So let's say we're just talking about the people who are reliant on public mental health services. Depends on from community to community, as I said, but what they generally can expect from most communities is to either make that initial phone call or present, and then possibly get an assessment within a couple of weeks or so. But that's not really an appointment. That's just an assessment that doesn't do anything but give the information to the people who are working in the system. And then an appointment comes where they truly get to start talking about what their needs are 90 days or more later. And what they might be facing is working with a caseworker who has 100 plus other people that they work with. And so you will have to fight for your needs to be met. You'll have to really become an excellent self-advocate.
And that's tough when you're in the throes of crisis and self-esteem issues, yeah.
Absolutely.
Why is affordable housing so important to one's recovery and well-being?
It's crucial. People shouldn't be paying more than 30% of their income toward housing, first of all, but you've got people across the country who are paying 50, 60, 70, 80, 90% of their income is going to housing sometimes. So there's problem number one. Leaves you very little left over for other things like food, utilities, and if anything should go wrong, you have nothing in reserve to handle those issues that come up. So it's important that we have affordable housing, of course. It's important that people not only have a place that they can go that they can actually afford, but I think the other piece of the puzzle really that's I want to make a plug for is safe housing and housing of someone's interest, something that somebody would want to live in. So when we start putting everybody in the worst, poorest neighborhoods that are high crime, low services, the walkability is nil, and we lump everybody together in those circumstances and say, but they can afford their housing, I don't think that's good enough. And there's one other thing I want to say about this. I think that a lot of people believe that, if you're on SSI, you get to be live in subsidized housing. And while some people do live in subsidized housing, the reality is subsidized housing has actually waiting lists that are months or years long sometimes. It's not uncommon for the waiting list to be 4, 5, 6, 7, 8 years long or be cut off altogether. You are left to free market, try to figure out how to live on $700 a month when the average rent in your town is, for a one-bedroom, is $800 or $900. Yeah.
How are children growing up in poverty affected? Well,
children who are growing up in poverty, first of all, they are affected by the stress of the situation. They sometimes are living in very high crime neighborhoods, and that's stressful, that causes anxiety, and so they're actually more likely to be, at the very least, labeled with a diagnosis of some kind of mental health challenge. So their odds go up there. They're more likely to miss school. They're more likely to be poor children are more likely to be expelled or excused from school forcibly, like removed from school, that kind of thing. So, and as we know, the education piece of it, when you lose that, you have somebody who hasn't made it through high school or something, then the odds of them breaking out of poverty really go up. So you combine all of these things, mental health challenges, a poor performance in school, or being left out of the educational system altogether, you don't really get much of an opportunity to thrive in that situation. So
it's an uphill battle.
Yeah. It is, yeah.
To wrap us up, what would you tell someone who is currently on SSI who wants to enter for the first time or re-enter the workforce but might be struggling with confidence or internalized stigma issues?
Okay, yeah, this is a great question because I would have loved for somebody to tell me this. What I would tell this person is, first, believe in yourself. Surround yourself by people who believe in you. If you have somebody telling you you shouldn't work, find somebody else to work with. I would definitely say that wholeheartedly. And explore what your passions are. That just because you have been labeled with a diagnosis of mental illness, let's say of some kind, no matter the illness, I don't care. Just because you've been told that you shouldn't work or can't work, none of that needs to be a barrier, actually. And so the world is out there to you, as far as I'm concerned. I see potential in everyone, and I think that also look at what your skills are. You have them. You have talents. You've had to develop them, because if you're in the mental health system, you've had to learn to be a people person, a self-advocate. You've had to learn a lot of amazing skills, patience, things along those lines. These are great skills for any kind of job. So,
well, thank you, Donita, so much for joining me today and for your wisdom and your really inspirational stories. Really appreciate it.
Thanks.
Money Basics is a financial self-sufficiency course designed for people who experience mental health issues. It is interactive, peer-taught, and person-directed. Learn more on the Money Basics website at money-basics.info. Project Open is a network of peer employment specialists in Oregon. To find resources, tools for peers who are seeking employment, or supporting others who are seeking employment, visit Project Open's website at peeremployment.com. To learn more about the issue of mental health and poverty, be sure to read an article by Esther Inton in The Atlantic titled, "Poverty and Mental Health, Can the Two-Way Connection Be Broken?" You can read it online at theatlantic.com. Thank you so much for watching. We'll see you next time.